So I've got a long wait for a hospital appointment, or maybe I can't find a family doctor. Which level of government is responsible for this? And will a vote in the federal election make a difference? It's a real question that applies to a whole bunch of issues in this election. Healthcare is the one we're focusing on because it's where the most federal money goes to provinces. So let's go over the 3 levels of government and what constitutionally they're responsible for. And one thing about this chart, we've put an asterisk beside things that fall between multiple levels of government. So you have the municipal government handling things like community centres and libraries, property taxes and garbage removal, and all these other examples. And across the country, there are also band councils that govern First Nations local communities. At the provincial or territorial level, you have things like the education system, the healthcare system, provincial taxes and the rules around rent protection, and all of these issues. Then at the federal level, we've got things like national defense, immigration and citizenship, criminal law, currency we use and banking, and these issues. The federal government also ensures each province has a similar level of public service and taxation. So it provides equalization payments to provinces to make sure those standards are the same across the board. Let's go back to the example of healthcare. It's the largest transfer payment that comes from the federal government to the provinces, and it's the biggest piece of a province's budget.
Healthcare in Canada is an elaborate and exhausting dance between different jurisdictions, not just federal and provincial governments, but also increasingly involving municipal governments and even Indigenous health authorities.
Before healthcare or Medicare was introduced in the 1960s, healthcare wasn't even really mentioned in Canada's constitution. Instead, provinces were given the authority of hospitals specifically, while doctors were seen as private and local. After World War II, Tommy Douglas, the Social Democratic Premier of Saskatchewan, introduced his plan for universal, publicly funded medical insurance coverage. That history is an explainer for a different day.
We're not rushing into this.
But that's where the federal government signed on and agreed to a cost-sharing plan.
Make it possible for the federal government to ensure financially that medical care will be available to all Canadians.
It would fund 50% of each province's Medicare if they met these 5 principles which are set out today in Canada's Health Act. By 1970, all provinces had established medical insurance plans, and this is why your health card is issued by your province today. So, should I blame the province when it comes to trying to find a family doctor? The health policy experts I spoke to say it's difficult to hold one level of government accountable given how these systems are set up. Under the Constitution, healthcare is managed and delivered by the provinces and territories. But the federal government constitutionally also has a duty to promote the well-being of citizens. All provinces still have to follow the Canada Health Act in order to receive federal government funding. That's called the Canada Health Transfer. And although federal funding started out at 50%, today it's allocated per capita for each province. On average, 20% of a province's healthcare budget comes from the federal government, while the other 80% is made up by the province through tax and other revenue.
Because of this murky kind of intergovernmental relationship, neither government is taking full responsibility for the quality of healthcare that we Canadians receive. We call it a blame game.
Mo says the blame often involves the provinces saying the federal government isn't providing enough money, while the federal government says the money isn't spent well. And this makes it even harder for voters to decide which government should be held accountable. The federal government does provide direct healthcare in some cases, like First Nations people living on reserves, for Inuit, and for veterans. And at the municipal level, local governments can introduce policy and infrastructure changes to entice new doctors there, which impacts the type of doctors and healthcare you might get in your community. The takeaway here is that many levels of government are involved in healthcare. And if healthcare is a big issue for you in this election, you might wonder whether your vote matters. But the federal MP you vote for can be there to hear the issues and concerns you have in your community.
They might direct to the appropriate government department at the federal level or at the provincial level, or they may well advocate on behalf of constituents for a particular issue that clearly falls within a federal domain.
What issues are informing your vote in this election? Send us an email to ask@cbc.ca.